Tax credits that help subsidize health insurance for thousands of Americans will expire unless lawmakers in Washington, D.C. address the issue.
News Channel 11's Jeff Keeling spoke with one local couple who depends on the Affordable Care Act as it is now and what could happen in Congress if they don't come to an agreement. Jeff?
Yeah, so those tax credits meant that Karen and Greg Cross's out-of-pocket premiums were about 10% of the retiree's annual $50,000 income. The pending changes are a sticking point in the government shutdown, largely, Democrats say, because they'd roughly double the share many people with ACA insurance pay. Recent numbers from Virginia's own state corporation commissions show similar projections.
We've been told that we could expect insurance premiums to go up way past the $1,000. Which $12,000 a year when you are on income of $50,000 is a lot.
Retired teacher Karen Cross and her husband both have pre-existing conditions and get insurance through the Affordable Care Act marketplace. They're not yet Medicare eligible. She is a breast cancer survivor and he also has a pre-existing condition.
I am not able to get any private insurance for 7 years. So I depend on the ACA.
Virginia Senator Tim Kaine said the reconciliation budget bill this spring allowed expiration of expanded ACA tax credits that helped subsidize insurance for families like the Crosses.
Anyone is worried about losing health care coverage, but if you're a cancer survivor, the prospect of losing your health insurance or seeing your premiums go sky high, very, very troubling.
Cross said she raised the issue with Congresswoman Diana Harshbarger at a February 28th town hall.
I asked a question about this to her.
It is up to me and my physician colleagues and my healthcare colleagues on both sides of the aisle to make sure there is some kind of program for those uninsurable patients.
The ACA isn't disappearing, but Cross says without some additional credits, her family's life will change.
We will go ahead and enroll because we can't be without health insurance. From there, we'll have to figure out whether we're both going to try to re-enter the workforce.
Kaine said he hopes it won't come to that for families like the Crosses.
I do think there's space for a deal very soon. And what makes me feel like it's out there within our reach is that the number of Republicans who have said we've got to fix this.
Kaine thinks fellow Democrats would welcome some give and take.
If there's program improvements, I'm all ears. I'm on the Health Committee in the Senate. We want to see people protected from rising health care costs. And we've heard you say the same thing. So let's negotiate about how to do it.
I still have hope that there are going to be some Republicans that will realize that they've got to look at what's best for their constituents.
We reached out to our viewing area's 2 Republican congressional representatives and Tennessee Senators Marsha Blackburn and Bill Hagerty. All criticized demands to negotiate during a government shutdown, with Virginia Republican Morgan Griffith adding he'd expressed interest in negotiations over the issue. Diana Harshbarger's statement included the following: "I am willing to discuss health care policy, but not while Democrats are holding the federal government and the American people hostage," adding, "Once the lights are back on, we can return to negotiations without the Democrats using Americans as bargaining chips."